Atkinson. Stand by, caller. There he goes.
Well, kia ora koutou katoa. Thanks very much for coming up to the Ministry of Health today for the update. So there's one new case of Covid-19 to report today that is in managed isolation, and there are no new community cases today. The new case is a person who arrived in Auckland on the 19th of October from the United Kingdom via Kuala Lumpur on flight EK448. That person is now in Auckland's quarantine facility. 7 further cases have now recovered, and the total number of active cases is therefore 68. Our total number of confirmed cases since the start of the pandemic is now 1,585. Yesterday our labs completed 2,311 Covid-19 tests, so our total to date is 1,072,492. So yesterday's testing figure was somewhat lower than the preceding days, reflecting the public holiday, but we did see good testing numbers over Saturday and Sunday, which was pleasing. In terms of testing around Auckland, the 7 community testing centres remain open, and COVID testing is also available right across the Auckland metro region at urgent care clinics, as well as at general practices. A reminder that anyone who does get swabbed for Covid-19 does not pay for that, it is free. So since the new community case was identified and reported on Sunday the 18th of October, there's been over 20,000 community tests in Auckland, and alongside our identification through contact tracing of close and casual contacts, their isolation and testing, this wider testing does help provide us with reassurance that there are not undetected community infections associated with the small number of cases we have had. So I want to thank all those who work long hours, both setting up for and undertaking testing in those community centres over the weekend, at the urgent care centres, and also those who process the tests in the city's laboratories. Information about where people can get tested remains available through Healthline or through the ARF's website. An update on a few other matters of interest. Yesterday we reported on being aware that in New Zealand a child who entered Japan had returned a weak positive test for Covid-19 on arrival last Friday, the 23rd of October. Now, that entry test into Japan is a rapid antigen test. It's not the PCR test that we do here for diagnostic purposes. We do suspect this is a historical case or a false positive result, and we're working closely with our Japanese counterparts to see if we can bring forward that second test, which would be a PCR test, and that would help confirm what we're talking about here. That is scheduled at this stage for Thursday, Japan time. At this point, that family is in managed isolation in Japan. Other family members returned negative tests on arrival, and it's important to reiterate all family members were tested prior to departure from New Zealand last week on Tuesday, and all tested negative prior to departure. We've also asked our Japanese colleagues to undertake a serology test of the case and family members. That will help us confirm whether this might be an historical case. Meanwhile, while we're waiting for confirmation from those additional tests, there are some actions that we have undertaken that are consistent with our precautionary approach we've undertaken in New Zealand to date since the outset of the pandemic. First of all, several close family members who remain in New Zealand were all isolated and tested over the weekend and all returned negative test results. The child had been attending a Napier-based childcare centre up until a couple of days prior to departure. The local public health unit has been in direct contact with the centre and the families who have children there to explain the situation and confirm that it's regarded as very low risk. And last Thursday, the 22nd of October, en route to Japan, the family flew from Napier to Auckland on Air New Zealand flight NZ5018, and anyone on that same flight between Napier and Auckland is just asked, if that was on that flight last Thursday, to just be alert for any symptoms, as we all should be as New Zealanders, and isolating and seeking a test if we have symptoms consistent with COVID-19. An update on the Ken Ray, which is the ship that's been sitting off Napier for some time. It has now docked at the Napier port this morning. The port's agent has gone on board and can confirm that not only did the crew return negative tests on day 6 testing, and none are symptomatic and they are in good spirits. None of the crew is leaving the ship while it is docked in Napier, and it will travel on to Tauranga on Thursday this week. An update on the international mariners in managed isolation in Christchurch. We have been reconciling our reporting of the number of infected individuals in that group with that of the public health unit. There are in fact a total of 29 from that group in the managed isolation facility in Christchurch who have tested positive for COVID-19. This is fewer than we had reported yesterday. 18 were identified at the routine day 3 testing. A further 8 were identified at day 6 testing, which involved retesting everybody as part of our process there. And 3 further cases were identified at day 9 testing. This was undertaken in the people who were close contacts of those who had been already confirmed as cases. In other words, the people they had been sharing a room with. So a total of 29 cases down there. They are all being retested on day 12, which is actually tomorrow. Finally, an update on the NZ COVID Tracer app. We have reached the significant milestone today of 100 million scans since the app was made available. An average of 850,000 scans were undertaken each day over the weekend. That's from 1 p.m. Friday to 1 p.m. Monday, and that is higher than our recent average of around 600,000 per day, and that included nearly 1 million scans on Saturday. So it's pleasing to see that response from Kiwis to our call to use the app. So saying, it's important that we up our game even further and get back into the habit of using the app to scan QR codes wherever we happen to be going, and I do want to request that businesses also routinely ask customers and visitors to scan the code. A reminder that the more we all scan, the safer we will be. Thank you very much. I'm open to questions. Please.
Yeah. Have you made any changes at this stage of your review into the testing of foreign workers coming in with that 6-day testing? And also, have you made any changes at the moment for the workers coming in on ships and their process?
So I'll answer the first part initially. Now, we haven't changed our requirement for anyone coming in, foreign workers coming in, to undertake the 14 days managed isolation and the day 3 and day 12 testing. The day 6 testing was added in because of our sense that there had been some intermingling of the that 235 group of 235 in the facility, some intermingling in that first 3 days. So in essence, we reset the clock once we got the day 3 test results back and retested everybody at day 6 as an additional measure. And then the day 9 testing for those who may have been close contacts. So at this point, we'll stick with that approach, but we do have another group who is coming in similar circumstances, and we will do a proper review. We still have yet to make a decision about just how long this current group will stay in managed isolation, and that decision will be made after we have got the day 12 test results back, and we will discuss that with our MB colleagues and also the local public health unit. In terms of people who are coming to New Zealand to replace crew on ships, as has happened recently, we are providing advice to the Minister and looking at the arrangements. Currently, there is no requirement for these people to do a 12-day managed isolation here in New Zealand before they join the ship. And the current protocol is they are only tested if they spend 3 or more days in a managed isolation facility while transiting, awaiting the ship. We're looking at all those options, including re-looking at whether, in fact, all these crew members should, in fact, do the 14 days managed isolation en route to the ships, particularly for ships that we know are plying routes around the Pacific and Australasia, as a number of these ships are. So we will update the public when we've provided that advice to the Minister and got some decisions around where we go with that.
Do you have any timeline on when you will have an answer back?
We'll have the advice of the Minister this week. And in the meantime, our plan is that any replacement crew members coming in, if they're there for more than 24 hours, we will test them before they join the vessel. It's really only just in the last few weeks that these replacement crews have started coming through. And my view would be that actually there's a common interest for both New Zealand and for those who own and work on the ships to ensure that replacement crew members are COVID-free when they join the ship. So we'll open that conversation up again with the owners, working with our colleagues from Transport.
So it's 4 days now since we've had another case linked to the marine employee. Are you confident enough now to say that that's a banana skin dodged in terms of forming a cluster?
Well, I would never say it's a banana skin dodged. I think we got a case, we took appropriate measures, and our response has led to the outcome we were looking for, which was that we quickly got around those cases and prevented any onward community spread. I don't think we're yet at a point where we can be fully confident. We still have a number of people who are close contacts in isolation, and they will be retested again at day 12. Some of them have already had that initial test. So we'll wait till we have those results. But what is encouraging is we haven't seen any additional cases from the venues that those cases visited. For example, the pub on the Friday night, there was a gym fitness class on the Saturday from one of the cases, and there were a number of interactions with smaller family groups. We haven't seen any additional cases, so really just the 3 people who are employees of the company and a close family member of one of them. Any other questions?
Is there any close contacts or anyone you're still trying to reach who are connected to that I don't know what you're phrasing it, outbreak?
There are there's nobody else who we haven't been able to reach, both close or casual contacts. So again, a really good response from Aucklanders, both in terms of isolation and testing, but also, of course, from the community for those people who were at the pub or the casual contacts from the fitness class.
And on the mariners, how long will they be staying at the Sudama before they're released, given some of them are testing positive at day 6? Yeah, so the day 12 results will be critical for a decision around that. At this point, it will be at least 3 days longer than the 14 days because we reset the clock for everybody once we had that day 3 testing, and that's why we retested everybody on day 6. But they'll be considered clear of the virus at that point, and they're therefore able to be released?
Decision to be taken once we have the day 12 testing results. That's been, the tests will be taken tomorrow, so we'll have the results the day after. What we're wanting to rule out is any evidence of sort of spread within the managed isolation facility.
And will you still use the Sudama for the next group that are coming through? That's
the plan. So until it is clear and this current cohort we're confident that they are infection-free, both those who have been returned positive tests, that we have to be confident they have recovered and that there is no one else in the facility who has got the infection, and then they will be allowed to go, and that will delay the arrival of the next cohort.
And any idea of when that next cohort could be expected at this point, and if there will be any further restrictions? I think we've been asking this recently, but has that been confirmed?
Yes, so the next cohort will not be able to come until we've made a decision about and cleared this current group from the hotel. So that's been delayed already by at least 3 days, possibly longer. And as we make a decision around how long we need to keep this group there for, we will determine whether there are additional requirements for this next group coming. Recalling that this current group had pre-departure testing and was on a chartered flight and were the only group that were in this particular facility.
In terms of the childcare centre, does that remain open, and should parents be concerned?
It does remain open, and one of the things we wanted to do here was to provide reassurance to parents, check that if there was anyone with symptoms in their families. There are a few children who've got symptoms of respiratory illnesses, not uncommon in this age group. Everyone who has got symptoms at the moment is getting a test. But there was really a really good response from the families with the reassurance and an ability to answer any questions. The centre can remain open. We think it is very low risk, especially because all 3 members of this family had returned negative tests before they departed.
Can you name that centre?
I don't actually know the name of the centre.
What about, could you provide more detail on the child's age, gender, whether the parents have been tested?
It's a toddler, and the child is under 5. It has a sibling who the child was travelling with mother and another under 5-year-old sibling, and the other parent in that family was already in Japan, so has met them there. And they're all in isolation now, but separated to try and avoid any further infection if this is indeed an infection.
Has the mother been tested? Was she known to be a previous case of COVID-19?
Yes, so all of them were tested before they left New Zealand. All were tested on arrival, and it was only this one who returned this week positive test, recalling this is a rapid antigen test.
And is there anything to indicate that they might have caught that? Were they overseas earlier in the year before lockdown?
Yes, my understanding is that they were actually in Japan earlier in the year and came back to New Zealand in March or April, which is one of the possible explanations is that they were infected earlier in the year. This child may be, and this could be an historical infection, which is why we've asked for the serology, which will help us confirm that.
Will you continue to double bunk workers at the Sedema?
Well, that's obviously one of the things that will be looked at. We're not involved in the arrangements that are agreed with the shipping, with the fishing companies. That's being done by other departments, but that's one of the things we'll look at.
And do you know how these workers feel being double bunked with their co-workers?
No, I don't. No. But what I do know, having just talked to colleagues from MB today, is that really high level of support and cooperation and compliance from those who are there, and and despite language being quite a barrier, there's a really there's good use of translators and very good understanding of what's required. And that will help with getting a grip around the number of cases and preventing any further transmission.
Just a couple of
Has your ministry provided any advice recently on travel bubbles either with Pacific or with Australia?
No, nothing further to what's already been announced. The next step in terms of the Pacific is with the Cook Islands, and we're working with them on essentially visits in both directions to check on the arrangements to make sure that both our countries are comfortable with the arrangements that are in place in each other's country.
Do you have a time frame for that?
No, I don't have a time frame. It'll be up to the new government to make a decision about that, please.
Just a couple of questions. So going back to the next cohort, I know it's based on the results of whether these current workers at the SUDEMA are not infectious anymore. Are you ruling out that that wouldn't be the next cohort potentially coming this week, though? Right, it wouldn't be as early as this week?
No, it wouldn't be as early as this week. It would be at least, if we're coming up to day 12, so it's at least another week off.
Okay.
And there would need to be time in between as well to make sure that the hotel was there was appropriate cleaning taking place, and also that staff had rest breaks too.
Yeah, and then with the younger, the child that's currently this low risk situation, you talked about the earlier trip to Japan potentially being looked at as an explanation for infection. Is your contact tracing team at the moment, are they seeing any other potential infection possibilities for the New Zealand context, or only that Japan visit at this stage?
So it could be that they were exposed to the infection either when they were earlier in Japan or on the travel back to New Zealand, or when subsequently in New Zealand. And this is something that has become apparent in some of our testing over the last month or two, is that because we went into a lockdown situation in March, there were no doubt a number of other infections that happened in the community, but that because people were at home, the infection didn't transmit on, and they weren't necessarily tested at that time. And we've seen several of these where people who we hadn't previously known as cases, some of whom had never been offshore, tested, produced a weak positive result, and serology showed that they had in fact been infected. So it's a possibility that it happened before they returned to New Zealand, or indeed once they were back in New Zealand. But the serology will give us an indication of that.
You haven't seen any interaction with someone that was COVID positive and that child at this stage? It's more it could be community?
No, nothing at this point. And as I say, all the close family members who are still back here in New Zealand have been tested and tested negative, and they're remain in isolation in the meantime until we have that follow-up result from Japan. Final questions?
Do you think it's time to look at bringing in RSC workers from COVID-free Pacific countries to work in our horticulture and viticulture sectors?
Well, it's not really a question I can answer. I think that's a broader government question. I know it's something that will be very near the top of the agenda for the new government, and it will involve advice from both our immigration and our MPI colleagues as well.
And just note that as of midnight tonight in Victoria, after a 112-day lockdown, they're getting some of their freedoms back. I just wondered if you had any reflections on how Victoria's managed to fight that back.
The only reflection I would have is that that it once again demonstrates the effectiveness of quite rigid lockdown type arrangements and restrictions on movement when you do have chains of transmission in the community that you're not able to control through testing and contact tracing. It also emphasises the importance of, if you are going to move with those sorts of measures, to do it sooner rather than later. And I think, but I'm really encouraged to see that what has happened in Victoria is they have managed to get ahead of and on top of the outbreak that they had. And again, that's the route to being able to free up travel and the economy again. And I guess it's a salutary reminder to all of us that this is a pandemic that is really in full swing in many countries, and right around Europe, the UK, Ireland, and we've seen the USA as well. And it puts our achievements and our need to be incredibly vigilant in New Zealand here in context. Thanks very much for coming to the opportunity.
Thank you.